एक पुअर इंसान कैंसर की ट्रीटमेंट कैसे ले सकता है? रिसेंटली देखा गया है कि देयर इज़ अ surge in the rate of women getting breast cancer and cervical cancer.
As I always say, overuse, abuse, misuse, three are dangerous for anything in life.
That's really great how AI is making difference in
Absolutely.
science and technology and healthcare today.
Absolutely. J.R.D. Tata's wife had a blood cancer and she was flown to US in 1938 or something for treatment. And while she was flying to US and returning back, she said, what must be happening to my fellow Indians if they don't get treatment? And that was the first 1942 cancer hospital started. Common man koi bhi ho, whether he rich or something, he can go to medical institutions where the facilities are available. Self-learning way. And I think AI will make a difference completely. गर्व से कहो कि हम भी कैंसर के पेशेंट नहीं है, साथ है.
In today's episode, we are going to meet a doctor who is a genitourinary and gynecology cancer surgeon, who is also a director in minimal invasive robotic surgery, also a professor of oncology at Asian Cancer Institute, Mumbai. Let's welcome Dr. Jagdeesh Kulkarni.
Thank you very much for inviting me for this podcast, Talk with Ekta.
Yes, sir.
And thank you. As I said, I also wish to tell you that the audience which is going to listen to this, hope they get the benefit of our discussion.
Definitely.
Thank you very much.
Sir, हमें बताइए कि how did you start your process into getting or becoming a cancer specialist?
Right. The story goes back almost 47 years ago when I finished my master's in surgery, which is an allopathic degree, which happens in medical colleges. I was in Aurangabad Medical College and I came to Mumbai, which normally everybody comes across the India for further, future. So I arrived here and in January 1977. Thereafter, I went to various hospitals with my all, credentials, and then started distributing my credentials to them that do I have any position in this city of, city of future.
Okay.
And I landed in Tata Memorial Hospital because I had seen a movie called Anand when we were students in 1970. True. And that was a lymphosarcoma of intestine.
Yes.
And that made a mark in 70 and we were all fans of this Hrishikesh Mukherjee. And there the one shot was that Rajesh Khanna goes into that radiotherapy department. I wanted to see that.
Okay.
So I visited Tata Memorial.
Okay.
And I asked them that do you have any position for medical graduates? And they said, yes, we have. And that was my point of coming into the oncology or cancer surgery.
That's great.
February 1977.
I can't imagine a film can be an inspiration for somebody to become a cancer specialist. That is so amazing.
Well, thank you very much.
Yes. अभी बताइए कि oncology actually होती क्या है?
Oncology actually onkos is a Greek word which means tumor.
Okay.
The tumor can be benign, which is harmless, and cancerous, which is dangerous.
Okay.
Now, this is a subject which comes during your medical curriculum, like individual level, like MBBS. It also comes during your post-graduation. But now we are now into a super specialty where people can directly go into this branch and treat these patients as well. Now, there are two components in this. One is medical oncology and another is surgical oncology. I belong to the surgical oncology. Okay. That is the stream, which is now gaining grounds practically everywhere, across the world, of course.
Okay. और cancer develop कैसे होता है?
Actually, the cancer is in very small, as a simple language is unabated growth of the cells. Okay. Uncontrolled. Uncontrolled growth of cells, which what it does is takes away the blood supply of the remaining organs and therefore patients suffer and ultimately succumb if not treated timely.
Okay.
That's it. It's one of the type business. It's not similar disease like viral infection, diabetes, blood pressure, some kind of things. It's like this. There's nothing to get worried about this.
So it's like a virus that grows in your body. Is it something?
Well, it's virus may cause it in some cases.
Okay.
But not necessarily it's virus. It's actually unrelated growth. That's right.
Yeah. It's a growth of the cell, right? और कौन से टाइप के कैंसर होते हैं?
देखिए, 2 types of cancer. One is body fluids. Now, body has got blood, urine, other structures, which are fluids, which are called hematological cancers, and solid tumors like liver, kidney, breast, ovary. So that's 2 types of cancers, blood cancer and non-blood cancers.
Okay.
These are the basic types.
ये कैंसर की स्टडी बेसिकली होती कहाँ पे है? Are there any institutes which are specializing in such studies?
Yes, of course. Years ago, the first cancer institution started in 1942, which was Tata Memorial Hospital. The story goes back. J.R.D. Tata's wife had a blood cancer, and she was flown to US in 1938 or something for treatment. And while she was flying to US and returning back, she said, what must be happening to my fellow Indians if they don't get treatment? And that was the first 1942 cancer hospital started, dedicated to the cancer. And subsequently, there are now over 700 institutions which are practicing cancer as a subject or cancer hospital. So that's an extensive network now, as it stands in 2024.
Okay. कैंसर जो अभी काफ़ी बढ़ता जा रहा है, तो आप बता सकते हैं कि एक पुअर इंसान कैंसर की ट्रीटमेंट कैसे ले सकता है? क्या ये बहुत ही एक्सपेंसिव है या कि कोई कॉमन मैन उसे अफोर्ड कर सकता है?
Again, there are two parts of the story. One is early diagnosis. Common man कोई भी हो, whether he rich or something, he can go to medical institutions where the facilities are available. Even now, with PM Yojana and all those things, they are practically available even small tehsil or taluka place as well. So there is no problem. He has to go himself. The effort has to come from him.
Okay.
Now, or he or his relatives. Number 2, the institutions, they should suspect also that this man is likely to have a cancer, in which case he should be treated and diagnosed early. So it's a two-way process, both ways.
Okay.
And it's possible. So I don't think cost should be an issue.
Okay.
As far as the diagnosis is concerned, treatment is also, and various schemes are coming up now. I don't think there should be any problem in India as such.
Wow, that's great. What are the symptoms of
symptoms?
cancer?
Okay. Now, very simple. 7 symptoms are there, which we have in our, dogma or say diktat, which is any painless swelling, any abnormal discharge, any bleeding painless, anything which is not going, unexplained loss of weight, unexplained fever, and also any bowel habit differences or even appetite loss. These are all the symptoms of cancer, which you should suspect. If it is not responding in 3 to 4 weeks' time, start suspecting. Sometimes you might hit the bullseye.
Okay. So ऐसा हो सकता है कि कभी-कभी लोगों को पता भी नहीं होता है कि उन्हें
ये बात सही है मुझे क्या होने वाला है. Even fitness freak people also have that aura that nothing can happen to me, but that's not true. It can happen to anybody.
True. Sir, रोबोटिक सर्जरी जो अभी बहुत ही प्रचलित है, तो उसका क्या रोल है कैंसर ट्रीटमेंट में?
Right. This is the new kid in the block, which is like जैसे देखा जाए तो the first robotic surgery started in 1999 in US. It started in Detroit. This very interesting story. Detroit is an automobile city, and they realized that the car accidents, when technology was used, accidents dropped, so less fatality. So, whenever people talked about robotic surgery in humans, everybody was saying, no, this is not going to be, how can a robot operate you or something? It's not a robot which operates. It is the men who practice robotic. A robot is a slave who will listen to us. Now that, when the city hall, it happened there, the robotic surgeons went there, and you have to go to City Hall to declare that this is being started now in US. So, having had an experience of car accidents reducing because of computerized surgical or robotic surgery, they said yes, and there it started with. It was originally started for if you can have a remote surgery, say for instance war situation.
Okay.
The soldier is ill there. Can we treat at a remote control? That's going to happen. By 2030, you will have a remote surgery possible.
Okay.
And also, one of the things which we always talk about, India, there is no land left. So if you are going to moon, perhaps you could operate from here. And
Okay.
so that's another new addition
Achha.
which we think about robotic surgery. So that's where, again, the concept is robot helps us. We are the masters, he is the slave.
Correct.
Thank you.
What is the role of AI in the research and development and surgeries in future?
Very good question, and everybody is talking about it. I'm on a BTech, to develop Indian robots at IIT Mumbai, and we talked about this. What AI does is, now whenever we are doing a procedure, an operation, which is recorded completely. Now, as I do stepwise 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, that computer or robot records that.
Okay.
Now, next time, when I am operating, and if I miss somewhere, it will give you alert. No, last time you did this.
Wow.
That's where the AI will
good.
come up.
Super.
And that is where, if at all a person goes haywire. Now, why this happens is because every human body is not same. Human body has a different things, and different people have different problems. In
Yes.
which case, that AI will help you. No, there is a alert saying that last time you did this way, this is not the way to do.
Even if there's some error,
Yeah.
it'll
And this is also for teaching purposes. Say when my student is there with me by the side in a different console, I can tell him this is it. Or even if I'm not there, AI will teach him.
Wow.
So that's a self-learning way. And I think AI will make a difference completely.
That's really great how AI is making difference
Absolutely.
in science and technology and healthcare today.
Absolutely. There's no doubt. No, actually for our life, AI will be important everywhere.
Right.
Everywhere.
That's great. सर अब थोड़ी हेल्थ एंड इम्यूनिटी के बारे में बात करते हैं. तो जैसे कि लाइफस्टाइल एक मेजर रोल प्ले करता है कि आजकल जैसे कैंसर बहुत ही कॉमन प्रॉब्लम या बीमारी बन गई है. So is it lifestyle one of the reasons that people are...
Let me come back to you. 20 years ago, I gave an oration. Is the cancer lifestyle disease? And I had one slide which clearly said, back in 70s and 80s, a student joining would have a 30-year span, which will be, he will join as a surgeon or medical officer, he will retire and then practice. So that 30 years. Today, the lifestyle is different. A surgeon joins at 30, he has to have second inning. And second inning is as important as the first inning.
Okay.
Because most of the people had only one innings. Now we are talking about 2 innings, perhaps 3 innings, because now they are saying old age starts after 80. Because 60 to 75 is young old. 75 to 90 is mid-old,
Okay.
and 90 onwards is old, and after 100 you call it second inning.
Wow.
So that's where we are. So
Achha.
these are lifestyle. Now coming back to the point, yes, lifestyle is very difficult these days. When we had a very serendipitous life, we had a very nice life. This was this we do and we done with it. Today is not. Today people are talking about every day is a new day, and every day is a competitive. Competitions have gone up phenomenally. And race, we are fighting against time and the race. Of course, that's where we are. And that lifestyle has added. Thirdly, and most importantly, longevity in men and women today has gone from 35 years in 1947 to now 75, 2021. Okay. It's going to be 80 in 2030. So people are going to live longer. At this point of time, just to give you an information, there are about 4 lakh people who are living across the world more than 100 years.
Wow.
Which almost means that you will have to re-oiling the whole body. You will have to replace several organs because he is going to live. So therefore, at 2050, they say 4% of the world population will be more than 100. 4%, imagine. and how much burden will be. And oncology or cancer will be a part of the story.
Okay.
So that's the burden of cancer, which is coming up very high.
Sir, does genetic play a role in developing cancer?
Yes and no. Yes, in some cases, yeah, and not in all.
Okay.
Now, again, we have to take it in a proper perspective that a person who develops a cancer after 75 or something is not to be called as a genetic. If he develops before the age of 60, perhaps yes, he may have a chance of his progeny developing. Now, again, in a genesis, there are two components, one male and female component. The female component may not have that. So that might overpower, which maybe if the females are overpowering generally speaking. So if that is so, well, that's it. But it may be possible there. But however, if the two parents have cancer, then there could be some chance. Again, I don't want to frighten the audience with this kind of discussion, but they must think about it. Yes, of course, there is some element of genetics.
There is some
yes.
chance. But does age play a role in developing cancer?
Well, actually, years ago we used to believe that it will be 5th and 6th decade and thereafter. But, well, in India, the cancer incidence is little younger age. And the reasons are our lifestyle. And one of the biggest problems of the lifestyle is the tobacco in various forms, be it chewing, smoking, or using machinery. So many things are there. So these are one of the biggest culprit today is the tobacco. Western world has gone out of the tobacco now, but India still reins into the tobacco.
True. Especially the rural areas or
whatever. They, when asked, they say, "Well, that's our entertainment." Well, you got to accept that word.
Does food play an important role?
Yes, fast food has been talked about, milk and other things, which sort of, I don't want to make a big comments on that. But just to say that vegetarian diet is perhaps the best, and home cooked food is always good. That doesn't mean that fast food is bad, but these we have to be taken. It has to anything which is in limit is the answer rather than overdoing. As I always say, overuse, abuse, misuse. 3 are dangerous for anything in life.
So too much of anything is
bad.
Too
much of anything is bad.
और सर ये क्या इम्पोर्टेंट होता है कि सनलाइट लेना, पार्क्स में जाना, आउटडोर एक्टिविटीज़ करना, ये सब रियली इम्यूनिटी को बूस्ट करने में हेल्प करते हैं?
Certainly, yes, certainly. Of course, sunlight is lucky. India, we got 9 months of sunlight, which is not there in the Western world.
Yes.
So I think that's very important because it has got several rays and vitamin D, which is one of the important nutrients which is required.
Yes.
And currently we are all sitting in ACs and we're not going anywhere. And lack of exercise continuously. And of course, eating habits have to be regular, exercise have to be regular. These are all, which are not there, but should be inculcated in younger generation to be told in the schools, colleges and all workplaces also. You must, in workplace also, you should give incentive to the people. Ki bhai, ek gym bana do, ho gaya. That is a good idea. They can use it, they may not use it, but at least direction should be there.
That initiative should be there. So what are the things that are responsible in developing cancer?
Well, of course, as I said, it's cancer, we always say 2 things, time and tide, waits for nobody.
Okay.
Now we have added cancer also waits for nobody.
Okay.
So when it starts, it comes with absolutely no sign at all. It is our high index of suspicion that has to come into play to understand that this is very early trend. If left alone, it may gallop or it may go step ladder pattern. First stage, second stage, but sometimes it cannot. So we got to catch them young, like cricketers. Catch them young. For that matter, everywhere. Catch them young and be done with it. So treatment can be done. Now, when we talk about treatment, there are 2 basic components. That means, can you remove that organ or can you save that organ? Say it happens in the kidney. Let me say my subject, kidney tumor. Is it possible to save that kidney because it is a vital organ?
Correct.
Is it not possible? And if at all it has to be removed, what are the alternatives? So these things are important. So if you catch them young, if it is a very small portion, we can save the kidney and he can carry on further. If it is not possible, then we can remove, because God has given two kidneys,
Correct.
so second kidney is there. But try and prevent injury to that kidney.
Yes.
The injury doesn't mean hitting each other, but injury also means because of bad abuse of drugs, lifestyle, so many things are there. And our common friends like diabetes, blood pressure, these are all there. And I always say that in cancer, talking about cure should be taken with a lot of pinch of salt. We should say, never talk about cure. We say that you try and live with it. Because cancer is no more a fatal disease, it is a livable disease.
Okay.
So you live with diabetes, you live with blood pressure, and you say, well, it's a elite disease. So say, well, cancer also is a disease, you can live with it rather than die of it because of fear, anxiety. Now, what are the important things are there? A person himself has to understand that even if he develops a cancer, he should not worry. He will be cured. Now, there is a second layer, which is his relatives, because they should not make him sort of isolation, saying that, well, now his days are limited.
Correct.
Number 3, friends. And number 4, his all professional colleagues. They should not make him feel miserable.
Yeah.
These are 4 important layers
Right.
in life. Now, having said that, what we can do as a physicians, our physicians' role is that we not to make him frightened, that, well, your days are numbered, but you have to tell him not to worry. We are always there. New technologies come up, we can always do. We can replace the organ, we can save the organ, or we can create new organ. So these are all possible.
Yes.
World is changing by the
Yes.
day. So there is
Yes.
no problem. So cancer ultimately should be taken as the disease which you have to live with rather than die of it. That's the message.
Yeah. So basically, positive outlook
Approach.
होना चाहिए.
Absolutely positive approach rather than negative approach.
Yes. Sir, usually recovery में कितना time लगता है?
From the time of diagnosis to the treatment depends on what stage. First stage, it just takes about 2 to 3 months. If it is a little longer stage or something, it may take a year or so.
Okay.
But at the end of that, you should be absolutely good quality of life.
Okay.
And if it is comes in a last stage, which sometimes patients do come in last stages. In fact, 40 years ago when we started, we used to see patients in the 4th stage, which is almost like, their almost life is getting ended. They were about 75%. Today that ratio has changed to almost 50%. But still we have a long way to go. In Western world, that year is only 25% are advanced disease. In India, we still have 50%. But that's coming slowly. It should come up. And as long as we can cure them, there'll be absolutely good quality of life as well. The next question comes always is, what happens to the progeny? As I was discussing with you, if a person develops a cancer after the age of 65 or 70, it's a sporadic cancer, it's never a familial. But if it happens earlier, then yes, there is. Now, again, 2 parents have cancer, some chance in it. There also, progeny, what time we start looking for the cancer is around 45 years. So 5 years ahead of time. In normal population, early detection starts at the age of 50, it starts at 40.
Okay.
But again, he doesn't have to get carried away. Now, another thing which comes to mind, which I've seen, is people talk about marriages. A person in young age developed cancer, can he marry? Certainly, we say if he goes 2 years and beyond, he can certainly marry. There's no problem. Either ways, both sides. So we have got several examples who have produced children who don't have cancer.
That's great. Actually, that's good to know, and it's good for people to know this also.
That's right.
That they don't have to be scared of the disease.
That's right.
They have to have a positive approach towards having disease and
Yes.
getting all right. Sir, are there any good institutes where one can study?
Oh, yes, of
cancer?
course. Now, one more thing is, we are talking about allopathic first, but I must honestly say that the current thinking is not only allopathy, that is medical MBBS, वगैरह, Ayurvedic, homeopathic also should be included in the curriculum. Now, as for the oncology training or cancer treatment training is concerned, it is available in all medical colleges across the board, be it private medical college, government medical college, plus there are cancer institutions, then private institutions with oncology dedicated departments. So across the world, we are more than 1,000 cancer related treatment centers. And they are going to be more and more, because I must say that government is pushing also. And recently you must have seen in UNO they talked about cancer. Big discussion was there, and we are pushing for that. And also private enterprises are coming. Practically everywhere they are coming. Not only in terms of other treatments like radiotherapy, medical oncology, but immunotherapy. So many things are coming, and also surgery. These are the 4 pillars of cancer treatment. They are all coming up in a big way. So by 2030, we should have absolutely no problem at all.
Okay. Recently, देखा गया है कि there is a surge in the rate of women getting breast cancer and cervical cancer. So, what is your take on that?
Well, cervical cancer is a totally, I would say, not totally, but to a large extent, a preventable cancer. Now, what happened was, I mean, I was dealing with this in 80s. Gynecological cancer included majority was cervical cancer, which has come down. And the most important thing is, women didn't have a toilets proper.
Okay.
Hygiene was not there.
Okay.
There were all myths which were there. My grandmother had this, my mother had this, so I also have this kind of thing. So these were all carried over the years. Now, come 2000, the toilets have improved, so many things, and there is definitely drop in cervical cancer, and HPV vaccine has come up for young girls before puberty. If you give them 3 vaccines, there is certainly, and we talked about once in Rajya Sabha there was a discussion on HPV vaccine to be made free, which has been government initiative, which is I think very nice, and I would strongly propose to all young girls that cancer service. Now, talking about cancer breast, certainly that's across the world. Because of late marriages, late delivery, so many things are there. But these are all there. You can't just go away from that. We can't criticize them. But early thing would be, only one thing which can be done is high index of suspicion, diagnose early, treat early, and live longer.
Okay.
That would be my one line thing.
Okay. That's very nice. Thank you so much. आपका basically specialty क्या है? What do you
My
specialize
specialty is a male genitourinary, which includes prostate, kidney, and female gynecology, cervix, and uterus. These are my specialty, which I am working for the last 48 years.
Okay.
And I have developed few new procedures also, few new things which has come a long way. And well, that's it, my specialty. What was in 80s is not in 2024.
Correct.
And then what we used to call the patients were advanced, now are becoming early, and we can still manage them very well. There's no problem.
So, आजकल के लाइफस्टाइल के बारे में आप क्या कहना चाहते हैं?
2-3 चीज़ें हैं कि एक तो eat well, eat healthy, exercise, avoid tobacco,
Okay.
and programmed lifestyle, more or less, and reduce the stress.
Okay.
Find some time for yourself rather than work. There are times, and it's very difficult to say, कि this is your working time. But I do not know how much discipline will be there. But apart from that, find time for yourself.
Okay.
And that's it. And of course, not to forget about checkups, especially after the age of 40. Or if you have family history, a little early. But not necessarily that you should go after, hammer and tongs to see what is happening to me. Am I suffering? And never have that phobia, fear, that I am going to suffer from cancer.
Correct.
Because my father had this. Never do that. That's not required. That's overdoing.
So, thank you so much, Doctor, for imparting your knowledge on this serious subject, which you made it feel very, very casual, comfortable, candid for the audience to understand कि अगर कैंसर कैसे डेवलप होता है और कैसे प्रिकॉशंस ले सकते हैं, क्या करना चाहिए, where to go, how to go, and also you said the treatment is not very expensive. So thank you so much for imparting your knowledge, and hope to see you again.
Pleasure all the way. And years ago there was a slogan, गर्व से कहो कि हम ये हैं. I wanted to make a little change in that. गर्व से कहो कि हम भी कैंसर के पेशेंट नहीं है, साथ है.
Okay.
Thank you. Thank you very much. Bye bye.
सो दोस्तों, आई होप कि आज का एपिसोड आपको पसंद आया होगा. आज डॉक्टर जगदीश कुलकर्णी ने हमें बहुत सारी नॉलेज दी अबाउट कैंसर एंड जिसे भी ये प्रॉब्लम है आज का एपिसोड ज़रूर देखें. हमें कमेंट कीजिए और बताइए कि आपको कैसा लगा. उसके अलावा अगर आप चाहते हैं कि हम कुछ और नए वीडियोस बनाएं नए टॉपिक्स पे, सो प्लीज़ कमेंट एंड लेट अस नो. एंड टिल देन डू नॉट फॉरगेट टू लाइक, शेयर एंड सब्सक्राइब Pod Talk with Ekta.